YouTube, and then I'm gonna hop on live on Instagram. And um, I will see you on Instagram.
But
All
I
right.
don't, I don't,
Hello, happy Friday.
hello everybody. I don't see it coming up on Instagram.
Okay. You're on the Sickle Cell Plus page.
Yeah, I don't,
You want to refresh it?
let's see.
Hi. Hello, hello.
I don't see you coming up on Instagram for me.
Okay, let me make sure I'm on. Okay, I am on Sickle Cell 101. Hi.
Hello
Um,
everybody. We're doing our usual Instagram hassle.
so
You're,
if you're on the feed,
oh,
just
maybe I should, yeah, I can
refresh the feed.
yeah, let me refresh it. There it is. Okay.
Hi, Papa Rock.
Okay, I'm on. I just gotta,
Okay, we got Dr. Q on. Do you guys have questions? Go ahead and start putting the questions in,
okay, I
and we will
requested.
get started. And I got a request from Dr. Q, so we're gonna get started here. Hi, Thorpe.
Hello,
Hi,
everybody.
Hasina. How are you guys doing this Friday? What's your Friday like so far?
It's cold here, about
It
40
is.
something.
It's cold, but it's sunny.
Yeah, it's nice and sunny.
Thank goodness. It's been rainy the past few days. Oh, we got our first question from Aisha. Do you guys you want to just hop right in? We'll just hop right in. We're running a couple minutes late. So, the question is, if I have osteoporosis, what can I do about it?
Well, osteoporosis isn't something that you can make go away right away, but I think you need to talk to your healthcare provider. I mean, the things that decrease osteoporosis, you have to have calcium in your diet. You have to you have to have exercise. So like people who have sickle cell disease can go on walks. They can, some people with, depending on what your diagnosis is, you can get exercise. But if you don't exercise and you spend a lot of time not exercising, your bone density goes down, as well as the fact as you get older, your bone density can go down as well. But basically, it's exercise, calcium, um, and just a good diet. But if you do have diagnosed osteoporosis, you should talk to your doctor about what's the best thing for you to do to increase your bone density. But exercise is walking would be just one of the things to do.
Is it sickle cell related, or can
Uh,
it be sickle cell
it
related?
It can be sickle cell related, but it's just a general, depending on your age. It's very common, particularly in people who don't exercise, don't get out. Like say if you're on the East Coast or something and it's really cold, and you don't get outside, and during the summer it's too hot to go outside and humid, that all that contributes to osteoporosis. And your diet to some degree, if you don't have enough calcium, that would be a problem.
Oh, another reason to work out and go out and get your body
Yeah,
moving.
yeah.
Uh,
Don't be too
yeah,
much of a
I
couch
haven't taken a walk
potato.
in a while. I like taking walks,
Yeah, walks
but
are
I
fun.
haven't gotten out in a while. So I guess that's my reminder to get out and about.
Yeah, we're lucky in
Um,
the Bay Area. There's lots of parks up in the hills to go on hikes.
all right. Um, Here we go. The next question is, what causes chronic pain and fatigue? in sickle
Well,
cell?
the fatigue is, related to your hemoglobin level at some point, and fatigue can also, so if you're really anemic, say your hemoglobin's like, I don't know, 8, 7, something like that, then you will get tired before other people do just because your hemoglobin is so low. But many people, maybe a majority of people who have sickle cell disease complain of fatigue. And I think um, it's partially the fact that you have anemia and partially the fact that you don't exercise enough. If you sit around a lot, um, that's going to contribute to fatigue. But there's other factors because it's so pervasive in people who have sickle cell disease that there must be other things that people don't recognize that actually lead to fatigue because it's a really common, even people who have higher hemoglobins with sickle cell disease. Chronic pain is really a complex problem for people who have sickle cell disease. Chronic, your pain actually changes the way your, your nervous system and your brain are what are the where the pain signals go to. So pain that you have over and over again, and with sickle cell disease, you have sickle cell pain events depending frequently that actually change the way your brain and your body reacts to pain. And if you have a lot of pain and you're using pain medications, it can lead to chronic pain. Even we said this before on the program, but even people who have had a bone marrow transplant who have no sickle cell or very little sickle cell blood can can still have chronic pain for months after they are cured of their sickle cell disease. So chronic pain is something that it takes, even when you miraculously have a bone marrow transplant, don't have sickle cell anymore, it takes a long time for your body to adjust and your nervous system kind of reboot and get out of that pain cycle. It's very complicated, the neurology behind chronic pain. And there's something called hyperalgesia, which people get when they're taking medication. So at some point, opioids actually increase your pain. And so counterintuitively, if you decrease your opioids, your pain can improve. So that definitely happens in an acute pain event that you get this hyperalgesia where the more pain medicine you take, the worse your pain gets. And you think the pain medicine, and the doctor probably thinks the pain medicine isn't working, so they give you more opioids and it doesn't work. If that's the case and you're upping, you may be experiencing hyperalgesia.
All right. So yeah, all of it is tied to sickle cell, chronic pain and fatigue, and it's pretty common. Dr. Q once also told me that chronic pain is usually more common in adults with sickle cell, and that's
Right.
because that damage has been happening year after year after year after year. I think, just with all aging, damage is occurring with anybody, even if you don't have sickle cell. But the older you get, the more damage, because your body's not new anymore, right? And it's being used. And well, with sickle cell, that happens a little bit faster, that damage. And so um when you get to be about a certain age, and for me, it was probably around 30 or, in my early 30s, I started experiencing chronic pain. And so it's usually something you also mentioned kids don't really get chronic pain because they, or I guess it's less common, I should say, because, they're kids, right? And so chronic pain is usually associated with aging with sickle cell. And it's important to know that.
And you
Uh,
have to realize that if you all pain isn't sickle cell pain, and all pain isn't sort of uh, it can be other things. Like if you have hip pain, that can be that can be avascular necrosis in any joint. If you have pain, you have to have that checked out because osteonecrosis can happen in any joint, your shoulders, your knees, your hips.
yeah.
So, and if you're having abdominal pain or specific to one particular area, you need to have that checked out. Make sure it's not something besides sickle cell pain.
All right. Before we move on to the next question about leg ulcers, I wanted to quickly answer a question. Somebody asked, all all of my children going to have sickle cell trait? If you have sickle cell disease, it depends on your genotype, first of all. If you're SS, all of your children will have sickle cell trait. Now, if you're SC or S beta thal, there's a chance your child can have sickle cell trait or C trait. So, if you think of hemoglobin SC, you can pass on the S or you can pass on the C. And the C is a C trait, which is not sickle cell trait. It's something different. So if you have sickle cell disease, all of your children will get some sort of trait. They don't necessarily always have to have sickle cell trait, but because SS is common and it's the most common type of sickle cell, and I'm assuming you have SS, um, all of your children will have sickle cell trait. All right. So what can be done about leg ulcers, Dr. Q?
Leg ulcers are really, really, well, if you have leg ulcers, you realize how difficult they are to treat. And leg ulcers, um, if depending on how bad they are and where you are, there are people who are specialists in wound care. So it would be good to talk to your primary care provider if they aren't getting better, that whether or not there's a wound care clinic somewhere near you, and whether that your provider thinks they might be helpful. Um, People have tried, chronic blood transfusion. They've even tried hyperbaric oxygen, um, and all those things may be somewhat helpful. They they may not really cure the ulcer. It takes, it takes a long time, but it takes wound care. You have to prevent it from getting more damaged from being, if it's around your ankle, you need to protect that area so it doesn't get re-damaged. Um, and then after it heals up, which could take months, you'll notice that your skin is a little bit thinner where the ulcer was. And so that needs to be protected because you could damage it again and have another ulcer. Um, and other things like, hydroxyurea, other kinds of medications. Hydroxyurea happens to be the one that I think it works the best for people in sickle cell disease. Um, so, doing things like that can help not cure the ulcer, but maybe help uh, prevent them in the future to some degree. They're very painful, very hard to um, resolve, and they do reoccur.
Yeah, this person said they're in Michigan. They have leg ulcers on both legs, and they've been dealing with it since June. Hopefully that's hopeful. I'm reading a comment about chronic pain, and someone said, and I'm 31 now, I think so too, because I've not been this lazy before or tired. Um, you are not lazy. You have sickle cell. Tired, yes. Lazy. Maybe you are lazy, but it's not like you could be lazy outside of sickle cell, right? But I think most of us, yeah, a lot of people use the word lazy and associate the term lazy with sickle cell, but really we have half the amount of blood than everybody else. And the blood that we have doesn't work as well as everybody else's blood.
Right.
So definitely not lazy unless you like choose to be lazy. Um, all right. Next question I have here. Somebody said I have lymphatic cancer and I have sickle cell. Am I more prone to getting sepsis?
Uh, you'd have to talk again to your oncologist, but depending on your chemotherapy, it can reduce your white blood cell count, and you can be during chemotherapy at certain stages during your chemotherapy, you can be at increased risk for really severe infections. Which is why sometimes when you go to an oncology ward, everybody's wearing a mask. It's not because of COVID, it's because the people are more susceptible to infections. And you really need to talk to your provider to figure out when am I most, when are my counts the lowest, and when do I have to be more concerned about getting infections. And sepsis is there's infections, but sepsis means you have an overwhelming infection and you're in the hospital and you're getting antibiotics and you're really, really sick. It's life-threatening. So that's another thing you need to discuss with your oncologist as to, how can I prevent, and I'm sure they've probably talked to you about it to some degree. When am I most susceptible and what can I do to prevent getting an infection?
Yeah. There isn't a correlation, right? It's just, maybe under treatment, they're even more suppressed, right?
Yeah,
And, sepsis could be not great if you're immunosuppressed. Is that the right line of thinking, or is
that
is
that
that
what that what if you're immune
if you
suppressed,
yeah,
I mean, that means your white blood cell, all uh, your uh, uh, infection fighting cells are have your bone marrow has been suppressed and you're not making any of those infection fighting cells. And
yeah,
if you're very immune suppressed, sometimes you'll be in the hospital in a um, isolation room with even the pressure in the room pushes the air out when people come in instead of having uh, um, the outside air come into the room. So it depends on what degree of immune suppression you have. For instance, if you're having a bone marrow transplant for weeks, you will be in a isolation room because while you're reconstituting your bone marrow, until you get to a certain point, you're very immune suppressed and get an infection. And in
I
those
wish you the best.
cases, even a viral infection can make you very, very sick.
Yeah, I just want to share, keep hanging in there. I know you have no choice, um, and that's tough, but keep hanging in there. Uh, the next question that I have, I'm skipping. So here's what's gonna happen. I'm gonna answer your oxygen question, but before I do that, there's a mom here that says their 3-year-old is having pain in her hand. What should I do? And I think that's just an easy question to answer real quick before we get to the oxygen.
So she's had her 3-year-old's just having pain.
Having pain in her hand, what should I do?
Oh, oh. So that's generally called dactylitis. And,
Mm.
children, depending, but children seem to do very well with um, even like acetaminophen, Tylenol, or um, non-steroidal anti-inflammatories like ibuprofen. They seem to be that type of pain seems to really respond to those types of pain medications. If that doesn't work, then you need to use some kind of opioid. You'd have to talk to your provider about it. But dactylitis or pain in your hands uh, is pretty common in sickle cell disease, usually in really small infants, but it can even occur in adults. And it's infarcts in the bones of you've got a lot of bones in your hands and your fingers, and those bones can be infarcted. I can imagine it's really painful. And you usually have swelling of your fingers and stuff like that. It's significant.
Yeah, it's common within children with sickle cell. I know growing up, I had that where my hands would swell. Um, I think I was even like probably older than a toddler, and that still happened. And I always used it as an excuse to not carry groceries and with my siblings. I mean, it's a legitimate excuse. Or to touch cold things. Like, somebody handed me a cold something. I was like, oh, I can't. Uh, in my hands. But yes, dactylitis is it's common within sickle cell in infants with sickle cell. Um, the treatment, or you discussed the treatment
Yeah, it's
for
just,
that.
it's non-steroidal. You don't in children with dactylitis, you don't necessarily have to use an opioid. You might, you have to use something like acetaminophen, Tylenol, or um, ibuprofen, Advil, whatever, first, and that actually may help a lot.
All right, we're moving on to the O2 levels. The question is, I'm currently admitted and my O2 levels are low. The barotic spirometer are low on the barotic spirometer, and walking around isn't helping raise the levels. What can I do? And then I think it's the same person. Let me know if I'm incorrect. Same person saying it's between 86 and 90. I need it at 94 or higher.
Right. So, I mean, if you're in the hospital, you definitely have people watching over you who know what your O2 sat is. And if it's below about 94, 95, then that's an issue. If it gets into the 80s, then that's really low. Um, and low oxygen tension in people with sickle cell disease can lead to complications. And you also have to figure out, depending, why is your oxygen saturation low? So I'm sure the physicians who are taking care of you are aware of that, and you can ask them, why do they know you, I don't know what's going on with you, but they would know, I would really have a conversation with whoever's taking care of you and figure out what are the options and why they think your O2 sat is low.
Should they be on oxygen at that range?
They would be on oxygen, yeah, if your O2 sat was 84, 86, or even up to the low 90s, yeah, you might be on oxygen. But if you're in the hospital, you need to talk with your providers about that because can order whatever they think is necessary. It could be a chest X-ray or something, depending.
So yeah, ask about getting on oxygen therapy. If it's that low, it sounds like you should be, but ask, we don't
Yeah.
know your particular circumstances. Um, Next question I have, this is a good one. Can the lab results show pain?
Sorry, I'm laughing, but no. I mean, that's a common. I've actually never, when I was in practice, I never asked a doctor who said something like that. So, what are you looking for? What do you think is on the, what's going to, if someone has
What's going to
pain,
determine?
what's going to
Yeah.
change on their chemistry or their CBC? I mean, how do you know they have pain? And the reason, and the response would be wrong because there are no lab tests for pain. And it's almost kind of like, well, I hate to say this, but I will. It's kind of like they want an excuse not to give you any pain medicine. So they're telling, well, I looked at your CBC. Yeah, you're anemic, but you have sickle cell and your chemistry looks fine. So I don't know why you have pain. I'm not going to give you any pain medicine because I don't see any lab work that indicates that I should be giving you something. And so to me, it's kind of an excuse not to give pain medicine because they have some, who knows what goes on up here. Um, but there is no lab test for pain. Zero, nothing. There, there just doesn't exist. Maybe someday in the future it might, things change, but right now, no.
Let me ask you a follow-up question on that. Do you think if that they were to find biomarkers are indicating pain, that would ultimately help or hurt patients in the long run?
Well, I think it would not be helpful because pain is so individualized and and your response to pain, different people respond to pain differently. And some people are very stoic and
Yeah.
I don't live in their body, so I don't know, but maybe they have pain and they just by the strength of their brain, they just suppress it and they look like they're in pain, but if you ask them, they say, "Oh no, I'm okay," and they're just like grimacing almost. Um, so pain is such an individual thing. It would not be if somebody thought they had a universal some kind of test for pain, it it couldn't it would be a bad thing
Mm.
because people who didn't fit into that little niche for whatever reason,
Mm-hmm.
they would not get any. Then it would really be bad because then somebody could say, well, you know, my little gadget here doesn't say that you have pain, so I'm not going to give
Right.
you any pain medicine. And that's you just have to believe people, especially if you have sickle cell disease, you can have pain, and you treat people for pain until you figure out what's going on. And maybe they're having a pain episode, and all they need is pain medicine. But you have to make sure it's not something else. Appendicitis, splenic infarct, avascular necrosis, pulmonary embolism. There's a lot of reasons to have pain.
Yeah. And I saw kind of a follow-up question or a question that can, why are doctors so against listening to sickle cell patients about what works for them?
Well, part of it is because they're doctors, and some doctors just feel like they know what's good for people, and so they sort of pain medicine isn't good for you, so you're not. I know what to do for pain, and this is what I do, and I'm not going to change what I do. Um, and so that becomes, it can be a problem. And the other thing is people, you know, Sickle cell disease is a rare disease. So you could go into an emergency room and actually see a doctor who has never ever seen a person with sickle cell before. And they've read about it in books, but they've never really seen a person with sickle cell. And then they don't really know what to do. And it's hard for a doctor to have somebody who's saying they're in pain, but maybe they're not acting like a lot of people with sickle cell pain don't writhe around on the floor. They just tell you, I am really having pain. And you have to believe them and you treat them and then you go from there. But I think a lot of doctors who don't know anything, who have never seen a patient before with sickle cell, it's difficult for them to give somebody pain medicine when they can't see anything. They don't look like that. There's nothing I can tell that you're in pain, but with sickle cell, there isn't anything. You just have to believe the patient that they're having pain and you treat it. And then you go from there and figure out what's going on, make sure there's not something else going on. But that's kind of a hard lesson to learn, I think, for some people, because you're treating something you can't see and uh, I kind of get it a little bit, but not totally.
There's another follow-up question here. So high retic count doesn't indicate pain.
No, your reticulocyte count, reticulocytes are the baby red blood cells just coming out of your bone marrow. So a high reticulocyte count can mean that you it's it's there's a lot of reasons for a high retic count, but it could be that you had some event and you had hemolysis for some reason, and now your body is trying to get your hemoglobin back up again, and your reticulocyte count is going up because you're trying to repopulate you're trying to increase your hemoglobin and to increase your oxygen delivery. The other thing could be people with sickle cell disease generally, compared to me, for instance, you would have a high reticulocyte count. My reticulocyte count could be like 1% or like whatever, really low. And your reticulocyte count baseline could be like 5% all the time because you're always having hemolysis and your body is trying to keep that hemoglobin up. So your retic count for people with sickle cell disease is always going to be higher than normal. And if you just had a blood transfusion and your hemoglobin is all of a sudden low and your tick count's really high, that could mean you're hemolyzing because of a transfusion reaction, that you're hemolyzing the blood that got transfused and your hemoglobin is going down. Um, but everybody with sickle cell has a higher than average retic count, and the more hemolysis you have, the higher it gets.
Yeah, so essentially, and I said this in a video, it's like your bone marrow is a factory for making blood. And, when you have a high retic count, that means you have so many baby red blood cells because so many of your adult blood cells are dying. So when an adult red blood cell dies, they make a baby red blood cell or, to replace it so that you continue to have blood. Um, And so a high retic count generally means your your adult red blood cells are breaking down faster. And so therefore your bone marrow is trying to make more to keep up with the demand of having red blood cells. So like Dr. Q says, it's always going to be elevated, especially within sickle cell, given the fact that our red blood cells only live 10 to 20 days, whereas typically red blood cells live for 120 days in somebody, in a person who doesn't have sickle cell. So you can see that that's a huge discrepancy. 100 days, 120 days is what your cell should be living at, but in sickle cell, they're only living at 10 to 20 days. So that's a really, really big discrepancy. So your body's always kind of playing catch up. And so that lab will always show an elevated level because your body's always trying to play catch up.
And things like fevers or any kind of illness will increase your, can increase your hemolysis and your retic count will go way up.
Really great questions, guys. Mm, 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 mm. I am going to ask about penicillin, and then I'm going to ask the question about gym and joining a gym. Is that good for people? So first, we'll start off with the penicillin question. What does penicillin do for somebody living with sickle cell?
So penicillin was, it wasn't started. I'm trying to think. I think it was started in Jamaica because
That
baby
study.
people with sickle cell disease used to their life expectancy was really short because as children they would get infections and they would develop sepsis that couldn't be cured with antibiotics and they would die. So in Africa, for instance, from malaria and other kinds of infections, there's a high mortality rate in children with sickle cell disease. And the same thing was going on here in Jamaica. And people thought, well, it's pneumococcus, this really common bacteria, seems to be one of the things that causes a lot of deaths in children with sickle cell disease. So I think in Jamaica, they started giving people penicillin, but then in this country, they had a study uh, to get to, and it was a study that was controlled. So you had half the people getting, half the children getting penicillin, half the children not getting penicillin, and they wanted to see, does penicillin really prevent infections? And I can't, it was the study did not go to the time limit that it was supposed to. And because they, five children in the non-penicillin group died and they stopped the study. So then everybody was put on penicillin. And it definitely, it doesn't cure an infection. What it does is penicillin will slow the infection down so that um, the parent would realize their kid wasn't eating, didn't feel sick, and had a fever, and they'd take him to the doctor. So one of the things that would also was a side effect of this study was doctors started teaching patients what to do when their kid had a fever or didn't look well. And so it became that if your child has a fever or doesn't look well, you need to go to the emergency room immediately. And so that also improved survival in children with sickle cell disease. But the penicillin was a really big deal. That really increased the life expectancy for people with sickle cell disease. And they usually stop it at about 5 years of age. Some people, in my practice, I educated people as to why they were on penicillin. But if the parent was like, I really don't want to stop penicillin, it was okay with me to keep giving penicillin after five. Um, and then, the other thing about giving penicillin is you have to give it every day because if you don't give it all the time, you could develop the bacteria could, that's going to cause resistance in bacteria. Although people were worried about giving penicillin to every child with sickle cell, thinking that, oh, that's going to create um, resistance in pneumococcus to penicillin, but it actually didn't for whatever reason. So
So
that's
penicillin,
why you give penicillin in children with sickle cell disease.
and to add on to that backstory, penicillin was actually, when they studied it in sickle cell, um, it actually was a what's the word? It helped it helped get newborn screening on the panel for sickle cell disease.
Right,
Um, in order to give a child penicillin, you had to know that they had sickle cell disease. And at the time, sickle cell wasn't part of, or, it wasn't, I guess, universally part of a newborn screening panel. And correct me where I'm wrong with the details, Dr. Q. And so that particular study was actually monumental because it's because of penicillin that all babies are part of the reason that all babies are screened for sickle cell because you have to know that a baby has sickle cell in order to give them penicillin. So, and because it was so life-saving, they found that that was a treatment option that, everybody, all kids under the age of 5 should be on. And actually, at a particular time, they thought sickle cell was a pediatric disease because they didn't see adults with sickle cell because they would succumb to to a lot, some of these life-threatening um, infections that penicillin actually ended up combating. And so they saw survivability go up after people knew to start taking penicillin for sickle cell. So that's a little backstory on why they give kids across the globe now penicillin and why kids are able to survive past the age of 5 with sickle cell because it used to not be like in Africa. They literally thought sickle cell was a pediatric disorder because they didn't see adults with sickle cell because they didn't survive past that age because they didn't know they didn't have the protection from penicillin. So sometimes people are allergic to penicillin and you can take other antibiotics, I believe, but penicillin is actually pretty instrumental within sickle cell. It's the reason why people live past 5. It's the reason why we try and screen for sickle cell now. And in the US, we're newborn screening is on every panel in every state in the US. We're working to get that to other places outside of the US, like, places where sickle cell is more prevalent, like Nigeria. I think Ghana has some efforts as well, because if we get them, you, you're able to diagnose a kid with a sickle cell, you're able to get them on penicillin immediately, and that elongates their life. So that's a little backstory about penicillin and why it's so important within sickle cell.
yeah, back in the day, if you didn't have a treatment for a disease, then they wouldn't put it on the newborn screening panel. And once they had penicillin as a treatment, then penicillin, but it didn't happen overnight. I think the last
Mm,
state, I can't remember, it was really late. It took like a decade before all
mm.
the states in the United States were screening for
Adopted.
sickle cell
Yeah.
disease.
All right. I am a sickle cell patient. Is joining a gym good for me?
Yes.
Love this question. Because you can't
Yes.
get out of it. You can't get out of it, even if you have
Yes.
sickle cell.
And you should, yeah. Yeah. And I think if you do want to go to a gym, you should really have a, if you have a provider and you're in a hospital, you should probably see if you can't get a physical therapist or somebody to show you how to go to a gym, depending on what you're going to do, if you're going to lift weights, or I don't know if you're going to what you're going to do in a gym, but to make sure that you're not going to try to start off lifting, 200 pounds dumb barbells because you think that's what you're supposed to do. It takes a long time to work up to a level that you want to be at, and you should have somebody coaching or helping you do that with sickle cell. It's because it could you have to, it takes a long time to build up. Uh, for instance, this is a personal story. I go to a gym and I've been going for a long time, but when I first started, I really in retrospect, I think it took me like years to get up to the point where I thought I was doing okay with in the gym. It took like I'm guessing it took 3 to 5 years for me to really get built up enough so that I could feel like I was actually doing something there. Hi, Nivea.
Hi, Nivea. I have a follow-up question. So yes, don't listen. They used to tell us, "Hey, don't exercise, don't do this
No.
because it could be a trigger, right?" And there's a right way and a wrong way to exercise, right? Staying hydrated, taking it at your own pace. It's not a marathon. You know, can start off very, very slow. Walk a 5-minute walk for a week, and then the next week a 10-minute walk. Like really, even like if you're bound to a chair, I know some people are bound to chair, there are exercises. There are even bed exercises. There's really no excuse, guys. Like you have to, part of sickle cell, it is a blood disorder. You have to keep your blood circulating. And how do you do that? Exercise. So can't get out of exercise. I used to use it as an excuse. I'm not even gonna lie. And doctors used to say, hey, don't exercise, but that's changed completely now, and they actually advise it. So there we have a basketball player in the NBA who has sickle cell. I don't know if you guys just heard that story of a woman who ran a marathon in New York. She has sickle cell. She doesn't have sickle cell. So a lot of the headlines, I'll give you guys a tip. A lot of the headlines say she has, woman to complete, first woman with sickle cell anemia to complete marathon. She actually doesn't have sickle cell anemia. She has sickle cell beta thalassemia plus, which isn't sickle cell anemia. So that headline is a little misleading because technically sickle beta plus is milder than sickle cell. So um, I've been wanting to try and reach out to someone to say, hey, she doesn't have sickle cell anemia because sickle cell anemia is really only SS and sickle beta zero. And those are the most severe diseases in sickle cell. But putting all of that aside, she ran a marathon and she has sickle cell, and that's still a great achievement. So we should be exercising, guys. We should be exercising. I'm telling this to myself too, because I have a walking pad that is collecting dust over there, and I haven't been doing this. So I'm really telling myself, but that really definitely needs to be part of, just trying to live healthy with sickle cell is getting your body moving around. If you're in bed, if you're in a hospital bed, you can do this with your legs. I think they're called ankle pumps. You do that with your legs to get blood circulating. Wear compression socks. That's also, especially if you're not up and about. Um, there's chair yoga. There's so many resources out there, guys. So you can't not exercise. So you can't get out of it anymore. Sorry. Um,
Yeah, when you're in the hospital bed, you really have to move around like what the way Cassandra's telling you, because not just for exercise, but because if you don't move, you're going to get blood clots, which are really
mm,
uh, not a good thing to have when you're in the hospital or anywhere. So,
I mean, blood clots with a blood disorder, you already know that's not
yeah,
that's not good news.
yeah.
My mom doesn't let me rest when I'm in the hospital. I know she's on the live. I see your comments, mom. Um, she does not let me rest. And like here, I'm thinking I'm going to the hospital. Oh, phew, I'm gonna, finally relax. And no, she doesn't let, she makes me walk the whole hospital. I'm over here carrying my little IV bag, walking around, like rolling my eyes at her. But that's what you're supposed to do. You gotta stay active. Otherwise, if you're in bed, I think your chances of getting acute chest syndrome go up. And then, that's why they make you guys, like I'm not part of it, but they make us do the incentive spirometer, that little
Right.
thing where you have to blow and, to keep the lungs, the air in your lungs, exchanging that out and it doesn't get stale because that can cause acute chest. So yes, you have to be active in the hospital. If you're not in pain at that point, then you need to be walking around, and maybe even if you're in pain, just like walk around, but like a little bit. But, but
Yeah,
yes.
the incentive spirometer is really good. There was a study that showed that people who used the incentive spirometer had 50% fewer episodes of acute chest syndrome. And you're when you're just sitting around and you're not doing anything, little parts of your lungs start collapsing. It's called atelectasis, and that's where you could get sickling and have the beginnings of acute chest syndrome. And the inspirometer keeps your lung expanded and stops that atelectasis from happening. So, for instance, the person who said their O2 sat was really low, or if your O2 sat's going down, using an inspirometer could actually help that a little bit, and definitely helps prevent acute chest syndrome.
I have a follow-up question here. Do adults still take penicillin? This is following the penicillin question and
Hmm.
kids taking penicillin. Do adults still take penicillin?
Well, no. And the reason is that over the period of your life, especially now that we have pneumococcal vaccines, etc., as you get to be older, your risk of dying from an infection gets less. Part of it is because you know you're sick before other people do, so you go to the emergency room, um, and it hasn't, no one's done a study to show that beyond the age of about 5, it really prevents infections because, again, nowadays, back in the day when it was being developed in the 80s, they didn't have the pneumococcal vaccines, but now they do. So that makes a big difference. And your immune system becomes more refined as you get to be older. Although infection is one of the reasons why people with sickle cell die. So if you have a fever, you don't feel good, even if you're like 25 and you just think, oh, I'm supposed to go to a concert tomorrow and I have a fever, I'm not going to the ED because they'll admit me and then I'll miss my date or something. Don't do that. You might miss a lot of dates after that if you don't take care of yourself. So fever, no matter what age, you need to be checked out.
Yeah, don't joke with fevers, guys. Um, so many great questions. Um, somebody asked, let's talk about gene therapy. I know a person's been asking about this. Let's go ahead and then I got a question online in the stories. First and foremost, and these are general questions about gene therapy. What do you know about therapies Casgevy and Lyfgenia, which are two of the most recent approved gene therapies for sickle cell? And then also, if you could speak to, somebody asked, what is your thoughts on gene therapy for older patients with sickle cell, which is, I would include myself in the older patients category here.
Okay, so gene therapy is, of course, life-changing for people with sickle cell disease. It's very, very expensive. So it actually has been shown that if you get gene therapy when you're younger, a teenager, or whatever, it's, the insurance companies don't want to pay for it because it costs, millions of dollars, a couple million. But it's been shown that if you get it young enough, as a pre-adolescent when you're 12 or something, that it actually saves the insurance company money because you don't have sickle cell anymore and or you don't have all the hospitalizations. So the idea that it costs too much and we don't want to pay for it doesn't really hold much water. Um, but so both of those different types of gene therapy are successful in um, curing, if that's what you want to call it, curing people with sickle cell disease. Um, the the one case I'm such a bad pronouncer. Case Guevi, it incre
Casgevy.
yeah, increases fetal hemoglobin to a degree where you don't have symptoms of sickle cell disease. And there are other um, people are working because that is so successful. Once your fetal hemoglobin is over 20%, your symptoms of sickle cell disease really go down. And with this gene therapy, they're way over 20%. So you don't have any symptoms of sickle cell disease. So that really has been an impetus for pharmaceutical companies and researchers to find other ways to interfere with the gene that turns off fetal hemoglobin so that your fetal hemoglobin goes up with perhaps even just a pill that you take. Um, so that's the one type of gene therapy. It increases your fetal hemoglobin to a very high level. The other therapy actually inserts a um, non-sickling hemoglobin into your genome. So that means that you start making, it's not hemoglobin A, it's actually a different kind of hemoglobin that's been engineered to not sickle. So, and I'm not sure if it interferes with sickling, but it's been engineered to not sickle. So you have this hemoglobin that is resistant to sickling, and it becomes, a major part of your hemoglobin, and then you don't have any symptoms of sickle cell disease. So both of those um, therapies um, do away with your sickle cell disease. Nobody knows for how long. So it's been quite a while. It's been, uh, you know, 10 years. I don't know off the top of my head, but nobody knows if it's lifelong or not. And we won't know, for many years how durable it is. Does it last? My personal feeling is it's going to last just like a bone marrow transplant, which is like forever. Um, but nobody knows that for sure. So those are the two gene therapies. They're both effective. They're like a bone marrow transplant, so that it's very involved. You have to donate different from a transplant. You're using your own blood for the transplant. They remove your progenitor cells, they transform them and then give them back to you. So it's much safer in terms of graft versus host disease, that kind of thing, than a bone marrow transplant because you're getting your own cells back. And then they proliferate, and they are, you know, more durable than sickle cells, so they kind of take over your bone, the circulating red cells. Um, and uh, so that, I guess that, I don't know if that answers the question, but oh,
What about it for older
old
people
people,
like
right?
me?
Yeah. So the it works for old people the same as it does for young people, with the exception that you have to be well enough to be able to withstand the conditioning, the chemotherapy you get before you get the gene therapy. So that is not a nothing thing. The for older people, they have attenuated or um, uh, less less intense chemotherapy for people who have who for older people with complications in order that they be able to get a bone marrow transplant. That is not what is going on with gene therapy. Maybe sometime in the future, they may figure out a way to give people who are more fragile gene therapy. But right now, they use, you know, the therapy that they use if you're sick, if you're not well, then you wouldn't necessarily be a candidate for that. And I don't personally know what the criteria would be in terms of somebody getting a gene therapy. And the other thing is it's not like a bone marrow transplant. It's not available everywhere in the country. I'm sure it's higher now, but at the beginning, when they were starting to do gene therapy, they estimated that because there were so few places, there's more now, I'm sure, but because there were so few places that were authorized to do the therapy, and it was so intensive that they didn't think they could do more than about 100 patients a year with gene therapy, so that it's a limited resource. Um, and that would also make it a little harder for somebody with complications to be able to get gene therapy.
Um, to add on to that, because I saw there was a follow-up question, does gene therapy help with the damage that sickle cell has done to the organs? Um, no, or the answer is no for now, right? So gene therapy is very novel. It's very, very new. So unlike bone marrow transplant, it doesn't have decades of research behind it. It's brand new. So those who get gene therapy now, they are pioneering this essentially, right? And we have to follow what their journey looks like. We have to see, does the gene therapy last? Does it last in all of these, different types of circumstances? We just don't know. We don't know a lot about gene therapy yet because those who have received it, they're probably only about 5 years in. Um, for the person who, and I'm not sure who the first person with gene therapy did, but I want to say around 5 years in. So we only have 5 years, and that's just one person, right? So we have very, very limited data as of right now around gene therapy, whereas bone marrow transplant, we have decades and decades. The very first bone marrow transplant was done in like 1980 something. It's in the 1980s. And so we have, a lot more data surrounding that. But again, what's attractive about gene therapy is it uses your own cells, whereas the bone marrow transplant, you rely on a donor. And so sometimes a donor isn't always available to people. Sometimes, and with the bone marrow transplant, the best case would be getting a sibling match. And so it's a sibling who has like, the same what they call HLA markers as you. And if you have that particular scenario, then you have a very, very high success rate for bone marrow transplant. And Dr. Q mentioned graft versus host. And this is where, that donor marrow is put into you, right? But your body may not recognize it and may fight it. And that's graft versus host. And that would be considered um, not a successful bone marrow transplant because your body is rejecting that donor. That doesn't happen with gene therapy since it's using your own cells. So it's important. There's they're both means of they're both one-time procedures and means of like, living a life without sickle cell or living a life with very, very minimal uh, involvement of sickle cell. But there's different ways to do it. And then also within gene therapy, somebody asked about, the difference between Lyfgenia and Casgevy. There's different ways to kind of fix sickle cell within gene therapy, if that makes sense. And so you'll see a lot of gene therapies and you'll see just even a lot of therapies in general try and target the fetal hemoglobin, because pretty much like sickle cell and fetal hemoglobin are enemies. Like they cancel each other out. So like you have high levels of fetal hemoglobin, it cancels out sickle cell. And so there are medications that are trying to up your fetal hemoglobin. Hydroxyurea is one of them. But also there's gene therapy who that is trying to up your levels of fetal hemoglobin too. And if you get it up to a certain level, like you're not dealing with sickle cell essentially. And so that's what one gene therapy is doing. There's others that are trying to change the gene so that it doesn't produce. And I the Lyfgenia one is always so hard to remember what exactly it does, but it tackles sickle cell in another way on a genetic level. So there are different types of gene therapies too. So when you ask about gene therapy, you're not really asking about one, you're asking about it as a group because there are different ways to manipulate your genes essentially to lessen the burden or lessen the symptoms of sickle cell. They're not really calling it cure with gene therapy. They're calling it transformative, just because, like I said, that we only have so little data as of right now, and we still need to gain more data to truly understand how this works within sickle cell. So that is our spiel on gene therapy. You guys ask every single time about gene therapy, and it's big. But I think, the best starting point is to make sure that you're able to, that there are different types of gene therapies. There's two approved in the US as of right now. That is the Lyfgenia and the Casgevy. Um, and then there are others that are currently investigational, so they're in clinical trials. And these are other ways to like try and lessen the symptoms, lessen the burden of sickle cell. So think of gene therapy as like very, I want to say infinite, but there's just so many ways to kind of tackle sickle cell using gene therapy. And so you have to kind of look at all the different types of ways to do that. And there are two available commercially. Um, and then there are several others that are being studied currently. That's my rant on gene therapy. Um, mm, 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 mm. And then yeah, the follow-up question was, does it help with the damage that sickle cell has done? As of right now, the answer is no. And it's part of the reason why I started taking hydroxyurea because I wanted to slow down that organ damage. So as of right now, there's nothing that's really reversing the damage that sickle cell has already done. So my thought process is, oh, let me get on hydroxyurea. That way, if I decide that I want to get a gene therapy, that damage is minimized and my body's in a better shape to, undergo gene therapy. A lot of times what people don't tell you is you might not be a candidate because the organ damage is already so much that the benefit outweighs I'm sorry, the risk outweigh the benefits. And so not, everybody might think, oh, I can just go in and get a gene therapy. You might not be eligible for it. So in the meantime, that's why I'm personally taking hydroxyurea so that I give my body the best shot for whatever comes after this. Um, and that's my why. And hydroxyurea provides organ protection and it drops the mortality rate within sickle cell. And there's a doctor famously says that, which, that's where it clicked for me. I was like, oh, I need to get on hydroxyurea because I want to live longer. So um, yeah, hopefully that's helpful. I felt like I've been talking for a while. How long did your body take to respond to hydroxyurea? Hydroxyurea takes some time. Dr. Q, I think it says like, you got to give it at least 6 months, right?
Right. Yeah, it doesn't really start working. You don't see big changes in the count in your blood counts for about 2 months. And then you don't really feel the effects for about 6 months. And then after that, you start realizing that I haven't had a pain episode or, it's definitely making me feel better after about 6 months or so. So you do have to give it a lot of time. A lot of people will say, oh, hydroxyurea doesn't work for me, but they really didn't give it enough time to have it work for them.
Yeah.
So graft versus host disease just is the graft, which is the bone marrow transplant cells from somebody else, starts um, working against the host, which is you. So a graft versus host disease means that the transplant is rejecting you. And there's lots of medications, and there's a new drug they give during the therapy that really decreases graft versus host disease. So it's not, it can still happen, but it's the therapies that they have and the prevention that they have makes it considerably less common than it was, say, 10 or 15 years ago when it was relatively common. Now there's degrees. Like sometimes you can give you can give medication to stop the graft versus host disease early, and then there can be graft versus host disease that's very difficult to treat called chronic graft versus host disease. But that's part of the transplant process when you're not getting your own cells like you do when you get gene therapy.
You guys are name dropping a lot of drug therapies. Somebody asked about how do we feel about Adakveo. Before I get to that question, and we're gonna have to wrap up here soon. I did want to share that yesterday, a company called Agios, and they're developing a potential drug therapy called mitapivat, and their data came out for their clinical trials, their phase 3 clinical trials. And I just wanted to make sure you all knew about that. It gets kind of technical, but um, within the clinical trials, they have two goals, which we call endpoints. And the first endpoint was that this drug, mitapivat, can increase your hemoglobin by 1.6 grams. The second endpoint was this potential therapy can decrease your VOCs or your pain crisis. And so I just wanted to put that out there. It did meet its first endpoint, its first primary endpoint, and the drug did raise hemoglobin in a certain percentage. And I don't want to give you all misinformation, so I'm going to encourage you all to take a look at the press release and take a look at the data surrounding that. But I share this because this company is hoping to file with the FDA, and this could potentially be a new drug therapy for sickle cell in the future. So, wanted to make sure you all were aware of that. Like I said, the company is called Agios, and the therapy is mitapivat, and it is yeah, its goal was to raise hemoglobin, and I think that data looked. I don't want to share like my just go out and look about it, go out and research that, and let me know what y'all think about that. But could potentially be uh, a new drug for sickle cell in the horizon. Did you hear about that, Dr. Q?
Yeah, it increased hemoglobin, but it didn't seem to decrease pain that much.
Yeah,
Um,
which
so
was
I,
that second endpoint.
yeah, so I think it's kind of disappointing to me personally because I thought it was going to
Mm.
it would actually
Decreased pain.
decrease pain if with this new medication. but it kind of indicates that increasing the hemoglobin by itself, although it's not it's a good thing, it's not a bad thing, but increasing hemoglobin by itself doesn't necessarily treat all the different problems with sickle cell disease, that it's more complicated than anemia. Um, and the way the medication worked, I mean, I'm not a researcher, but I personally thought it probably, if I had bet on it, I would have lost because I would have bet that it decreased pain significantly, but it really didn't. So um, that's one of the things you have to think about is that just increasing your hemoglobin doesn't necessarily decrease your pain because when it increases your hemoglobin, it's not normal hemoglobin that's getting increased. It's your sickle cell hemoglobin, which is not a bad thing. If your hemoglobin's 6 and it goes up to 8, you're going to feel a lot better and it may be beneficial on some level for you. So it's not like
So
it.
thoughts on a
Go
oh, go
ahead.
ahead.
Go ahead. No, go ahead.
Thoughts on a doc bio. Can you hear me?
What
Oh,
was
what
it?
are your thoughts on a doc bio?
Crizolizumab.
Mm-hmm.
Well, crizolizumab, there's actually another drug like crizolizumab, but crizolizumab um, had a very large study, and it turned out that it wasn't as effective as they would have liked it to be. Um, and I think part of the problem with that study was it was a little bit too big, and the um, subjects in the study were too diverse. And so it was done in Africa and it was given to a lot of people that probably had different levels of care. They they may not have been taking the medication the way they should have been. So I think there's a lot of issues with that, that it turned out that it didn't really decrease pain as much as they would have liked to have had it decrease pain. So again, it's really hard to get a drug like, the poster child for sickle cell disease is hydroxyurea. So it's really hard to get a drug that is better than hydroxyurea, which is kind of the benchmark for what should happen if you have a drug with sickle cell for sickle cell. Um, and it's helpful, but it's not as helpful as what people would hoped it would have been. And there's a lot of issues with the study, so um, the jury is still out. Although it's not, I don't think it's as good as it could be. They can't change the drug, but I don't think it's going to be as effective as what people would like it to be.
Yeah. All right, Dr. Q, I'm gonna ask you to give your special statement and then we'll take one more question. Do you think we have enough time for that?
Yeah, give me a question and then I'll give my little statement here.
Okay. Oh my gosh, the pressure. Um, mm, 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 mm. I feel like there's a couple that we can knock out real quick. Short ones. When should hydroxyurea be taken daily? It should be taken daily. Is there really a time when best to take hydroxyurea?
There's not any, you just have to take it the same time every day. It's basically, um, if you, it doesn't work, it doesn't have a long half-life. So if you don't take it for a while, it's just, the changes are just going to go back to the way they were before. So if you don't take the medication every day, or you skip a few days or a week or something like that, the effect goes away pretty fast. The fetal hemoglobin will be around, but the fetal hemoglobin will start going down not really fast, but fast enough so that it may not be protective. So you got to take it every day.
Yeah, that was another follow-up question. What happens if you skip taking your hydroxyurea meds for days?
Yeah, so the fetal hemoglobin is just going to go down, and hydroxyurea it doesn't work the same for everybody. So some people have a really good response, and their fetal hemoglobin is like 20% or something like that. Other people don't have as the same response. Maybe their fetal hemoglobin is 10 or 15%. It's still protective, but that means that when you stop it, it's going to go into a non-protective level quicker. So, um, depending on what your fetal hemoglobin is, as it goes down, you're going to start having more and more symptoms of sickle cell. And that can happen within a short period of time.
Um, just continuing on with the hydroxyurea, because you guys had a lot of follow-up questions on hydroxyurea. Um, does hydrea mainly help the retic counts? I've never had this explained what it does. So does hydrea help with, and that's not a dumb question at all. Does
With
hydrea mainly help with retic counts?
reticulocyte count,
Hmm.
yeah, hydroxyurea increases your hemoglobin, and so your body, once your hemoglobin gets to a certain level, your reticulocyte starts count goes down because your reticulocytes are responding to anemia. So once your hemoglobin goes up to a certain point, the reticulocyte count, your hemoglobin is going to go up, your reticulocyte is going to go down. So and that's what happens with hydroxyurea. And it depends on how long you're taking it and how good a response you have, and whether the person who's giving it to you is checking your counts and changing the dose to be what some people call the maximum tolerated dose, which is the dose that at which you have the highest level of fetal hemoglobin with the less effect on your blood counts.
Somebody said taking it at the same time of day. Can you explain why that is? Why you're why to take the any kind of drug therapy the same time each day?
Well, they have like a half-life. So the half-life is how long it takes for half of the drug to go away and not be effective. So if you take it at all different times, the half-lives are going to start kind of going on top of each other or be too far apart. And so if you take it every day, it's much more consistent. The blood level of the medication is going to be more consistent than going up and down by because you take it, you miss days, or you take it, in the morning sometimes, at night sometimes. So it'll taking it at the same time just makes that level, the drug level in your blood be constant.
More consistent.
It takes it takes a few doses before you get to that level.
Yeah. Um, and then the last one is I'm prescribed hydroxyurea 1,000 milligrams once daily. Is that okay?
Depends, if you're an adult, that's kind of a standard dose, but it all depends on your count. So different people, depending on how, what's going on with their bone marrow, different people are going to have different responses to hydroxyurea. And so that's why you need to have your blood counts, particularly when you start taking it. You have to have your blood counts monitored to make sure the dose is not too low or not too high. And for kids, the dose is always going to go up, up, up because they're getting bigger and bigger. So they have to be monitored more closer than adults who generally have the same body mass all the time.
Yeah, so that dosage is dependent upon your body mass and your weight.
Yeah,
So,
and whether you take it, if you're not very good about taking it, and it shows up in your blood count. So if you get your blood counts done every month or so, the person looking at those counts will know whether you've been taking it or not,
yeah.
because they will they'll realize your fetal hemoglobin is going down, the size of your red cells is going down, and so they'll know that you're not taking it, or you're taking it, but they need to increase your dose.
Nivea has a question, and
What?
I don't know if you can answer this quickly. What are
What?
the symptoms that require spleen removal? It's our girl Nivea. So
Require what?
spleen removal, symptoms
Oh,
that
oh,
require
oh,
spleen
oh, oh.
removal. Next
So,
steps.
so if you have hemoglobin SS, generally speaking, your spleen has disappeared by the time you're about, well, for sure when you're 10, but about 5 years old. So after a certain amount of time, your spleen gets completely destroyed by your sickle cell if you have SS or S beta zero thal. And so then it's not really an issue anymore. You have functional asplenia, which means you're more susceptible to infections because you don't have the spleen anymore. Um, and then in younger kids, they still have a spleen and it can be enlarged. The sickle cells can interfere with the circulation within the spleen and it can get enlarged. So every parent should know how to feel for the spleen in their child, and they should check it once in a while, especially if they don't look like they're feeling very well. Um, but it can get enlarged very, very rapidly. So um, you just need to know in a kid how to check for the size of the spleen. In in people who have SC disease, the spleen does because they don't sickle as much, their spleen doesn't go away when they're young kids. And so people who have SC disease can have splenic or spleen enlargement when they're teenagers or a little bit older.
Yeah,
So
this person
there's
has beta thal and yeah, and I think it's an adult.
Yeah, if you have S beta zero thalassemia, then it's like sickle cell and you can have it when you're younger. If you have S beta plus thal, then it depends on how much A that plus means. And if the A is really high, you would might be susceptible at an older age. Although um, I'm not sure that anybody's done history to see if you have S beta plus thal and your hemoglobin A is 5% or 10%, whether that's protective or not. I've never seen a study like that.
All right, I tried to get as many of your
Oh,
questions
and
in.
I have SC and mine enlarged when I was 17, which is that is about the age when you'd start seeing your spleen enlarge. In young children, you might need a splenectomy because you've had life-threatening splenic sequestration. In someone like this young person who has, well, I assume they're kind of young, they're definitely younger than me, that that has SC, that they wouldn't necessarily need a splenectomy. They would just have an enlarged spleen.
All right, guys. Ooh. All right, Dr. Q, I know it's overtime. I'm so sorry, but if you
But
want to
that's okay. So
wrap up for us.
what what Sickle Cell 101 does, and what I try to do is just give you information. So I would say almost 100% of everything you hear from me is my opinion. And so other doctors would have a different opinion than me, or they might know more about a certain, you know, something about sickle cell than I do. I don't know everything. And so what you need to, and I don't know anything about anybody who's listening to this. So you can sometimes take what I say with a grain of salt, but it's only my opinion, and I'm trying to educate you. I'm not trying to get you to take any kind of medication, get any kind of therapy. All those things are up to you and your healthcare provider. They know you the best, and they know what would probably work best for you. This is just general information, and it's some frequently just my opinion. So with that, I think we're done.
Yes, we are. And I'm if somebody asked about that new, I just pinned it right there, or I just put the new drug, the not the new drug, right? But the drug
Hmm.
that's progressing is called mitapivat, and
Right,
the company's name is Agios if you want to look
right.
that up. All right, guys. Have a wonderful weekend.
Bye-bye.
Happy
Have a nice
Friday, and
weekend. We'll
take good
see you
care.
in
And
the first
yeah,
week in December.
I'm gonna be the Dash.
Oh,
I don't know
that's
if that's the first week
right.
of
The
December,
first
but
week.
we'll see you soon.
We'll see you soon, sometime in December.
Yes, yes.
Okay, bye-bye,
Enjoy the
everybody.
holidays, Thanksgiving. Bye, guys. Oh.